we're going to demonstrate today how to use an injection kit. First of all, I'd just like to say that we are not qualified medical professionals, nurses or doctors. We're doing this as Addison's adrenal insufficiency patients who carry injection kits, and we'd like to demonstrate how to use these kits using an Acto vial where the water is with the Solu-Cortef, and also using one where you have to mix it yourself. We are going to actually do the injections, but we will be injecting saline, which is sodium chloride, not the hydrocortisone. This is the first time that Desi will have done injections, so she's a little bit nervous, but she'll be fine. But we're doing this hoping that we can give people out there some confidence in how these work and that it's not as difficult as it seems.
Thank you. And this is my little kit that I carry in my handbag all the time. It contains 2 Solu-Cortef Acto vials, as well as a spare, 2 syringes, 2 needles, alcohol wipes. So first of all, I'm going to demonstrate how you push down on an Acto vial. It comes like this with a little cap on the top and a little rubber stopper. The powder's in the bottom and the saline solution is in the top of the Acto vial. So you're using this part of the hand, which is nice and firm on a solid surface. You push that over there and push down hard, and it dislodges that rubber stopper, and then you just swirl it around until it dissolves. Now, here I have an Acto vial that is empty, and we have filled with the saline solution so I can inject myself. A good idea to swab the top of the rubber surface and take the cap off the syringe. Load a little air because that helps to draw up the solution with, so you don't get a vacuum. Push it into the top of the Acto vial, turn it upside down, push in the air, and then the needle should sit at the base of the fluid here, once it dissolved fluid, and you just simply draw down on the syringe and it fills to 2 ml solution. Drawing it all out. There we go. So, there. Oops, sorry. Out. At this point, you just push up till the solution's at to the top of the needle, and it comes out at the top there. So now I have drawn up the syringe with the saline solution. I'm just going to put the little cap back on it to keep it sterile while I just take the little alcohol wipe and wipe my leg. I'm going to use this part of my thigh muscle just here. So I'll just swab that. Here we go, my first time injecting myself. And take the cap off the syringe and just keeping it nice and taut by holding my forefinger and thumb there. I'm just going to inject by just pushing it straight in. All the way. Oh, that wasn't too bad actually. Pull back. Just a little bit, there's no blood. And now I can push in Solu-Cortef. Well, that was a lot easier than I thought. I pulled it out and just a little swab and I'm done. Thank you very much.
Injection kit, and because I live in Hong Kong, I have it in English and Chinese, and inside it I just made this from a Tupperware container. I have in it my needles and my Solu-Cortef in here, as well as a letter and also an instructional leaflet. So I will need my Solu-Cortef and a water, the two elements. So you have the two items, and then you have the needle. So you would first break off the top of your water and break off the top of your Solu-Cortef, and then take your needle and your syringe. You just do a slight twist and a pull like so to get it off, and then you just pull back until you have 2 ml. Sometimes you might get a little bit of air, and you need to go at a slight angle, if you can see, so you've got the syringe in the water, and go to 2 ml. Then put that into the center. So then remove the syringe and wait for it to dissolve. And then I'm going to swab the top of that. And it's nice and dissolved now. You can see there are no pieces floating in it. So then remove the cap from the syringe, and you can draw up air. It does help, so I've drawn up 2 ml of air. Doing that, actually, it doesn't make a huge difference, but it can help with the pressure of pulling down. As Desi said, you need to bring the needle down so that you are actually in the fluid, and then because of the air you can actually see it pulling down. I'm not actually pulling on the plunger. The air that I put in is giving the pressure to fill the syringe automatically. But the last little bit of it you do need to pull down yourself. So I'll continue. You have to keep pulling the syringe down so that you're in the solution. Otherwise you won't get it all. Once you have it all ready, then you just push it up, and you can also flick it for any air bubbles. So now this is one that is filled with sodium chloride, so it doesn't contain hydrocortisone, and Des is going to demonstrate giving an injection to somebody else. So I'm the sick AI patient and I can't inject myself, and she's going to inject me, so I'm going to hand it all over to her. Thank you. And you have to pull the pants down. Okay. Thank you. Good. Right here. How's that there? It's fine. Thank you. Alcohol wipe. Take the cap off. Nice and firm skin. Draw back a little, make sure there's no blood. That's good. Feel it there. Very good. Solution. Good. Done. That didn't hurt one little bit. I didn't even feel it. That could have potentially saved my life if I'd been in crisis and we were using real hydrocortisone. And so thank you, Des, you did a wonderful job. Just one last point is to dispose of sharps carefully in your home in case you have children or anybody else around. And just one more note that we are not nurses or doctors, we're not medical professionals. This is just for information purposes only. And please do refer to any guidelines that you've been given by your doctor or nurse. And most importantly, ensure that your injection kit has everything it needs. And if you have given yourself an injection, refill it as soon as you can.